Packard's Cancer Center after I was diagnosed with Hodgkin's lymphoma, and I was told about a clinical trial that I might qualify for here at Packard. So 2 days later, after that initial appointment at the Cancer Center, I came here to Packard, where I met Dr. Link, and I was just amazed by him.
So Jennifer came to us with intermediate risk Hodgkin's disease. And this is a group of children and young adults where we're quite confident that we can cure them, but we are very concerned about the late effects of treatment. So part of what we concentrate on is, can we minimize the price of cure? So our current studies are aiming to reduce the amount of radiation we give and the amount of her that gets irradiated. And that really is the focus of the trial for which she was eligible and which we entered on her.
The care at Lucille Packard was better than any other hospital that I've ever been to. All of the doctors and nurses, they just had this spirit about them that was just so positive and uplifting.
Jennifer is a wonderful patient. So it turns out that she had a number of problems related to her diagnostic workup as well as her therapy, which we don't often see. So first of all, she came in and she had an unusual lesion in one of her hip bones, which we didn't really think was related to Hodgkin's disease, but we couldn't be certain. And we had to make sure that it wasn't Hodgkin's disease, because that would have required more intensive treatment. So she had to undergo an additional bone biopsy, which of course was uncomfortable, but fortunately we found out that it was indeed not related to her Hodgkin's disease, and we could treat her with less intensive treatment.
You know, there was one moment where he really shined as a doctor after I had my first radiation treatment, because that was the hardest part for me mentally, just knowing how strong each treatment was. And so I came here after the clinic had already closed, and I didn't have an appointment with him, and he spent over half an hour with me just explaining to me why it was beneficial and why I should do it. And you know, he never sugarcoated any of my questions or any of the answers to my questions. He always told me exactly how it was. He explained it to me perfectly, so I understood it, and I left that evening, you know, feeling so much better, like I did every time I met with him.
Well, taking care of children with cancer requires an entire team. And one of the wonderful things that we have here at the Packard Children's Hospital is the BASS Center for these children, where we have the nurses and all of the facilities necessary so that the patients don't really have to go very far. Jennifer was getting chemotherapy every week, and so we could see her in the clinic, and she could just walk a few yards to our BASS Center, where she could get her chemotherapy administered, where the chemotherapy was actually drawn up by the pharmacy, which was right there, and that pharmacy is manned by pharmacists who are experts in chemotherapy, so we have confidence that there will be no errors in dosing, etc. The nurses are all very familiar with the administration of treatment, and so they get to know the patients, they get to be part of the team that takes care of the patients, and so that the patients can feel quite at home in our center. So this really has facilitated the care of, or the very complex care that we have to give children with cancer.
Every time I walked in, everyone always had a smile on their face. They were so supportive, so welcoming, so caring. Everyone went out of their way to do just the smallest little thing to brighten your day. Just, you know, it was better than I ever could have imagined.